Good afternoon, and thank you, Sarah. It's so great to see so many of you are participating from around the state on this webinar, on this chat. More than 400 folks signed up, and it just really means a lot to me for each one of you taking the time out of your busy schedules and calendars and important work to hear about some of our next steps when it comes to our transition beyond 2020. First, let me say thank you. Thank you for your partnership over the last 10 years, but also recognizing the life-changing work of BHC. Your day-to-day fight for health equity and justice continues. Every day, your work is making a difference in the lives of Californians, and we're proud to be working alongside you to transform communities into a healthy place for all Californians. I also want to acknowledge that change is hard. I'm sure we can all agree on that. And anytime a foundation goes through a major transition, it causes some anxiety both internally for staff and externally for our partners who mean so much to us. If I can offer you any comfort, I want you to understand that the plan for the next 10 years doesn't represent a sharp left turn or a sharp right turn. It is built from the strong foundation that you helped lay down with us as partners over the last decade of work in BHC, and from the wisdom of communities most impacted by structural inequity and health inequality. Along this journey, we've learned a lot together. You've changed us for the better. We are not ending our Building Healthy Communities 10-year initiative with the same and precise strategy we had when we started. And that is mainly because of you, your feedback, and your input. You taught us about the pillars of agency, or people power, and belonging to drive change. You told us what was working, what was not working, and we tried to listen and adjust with you. From a personal perspective as a health leader in philanthropy, it's ironic that we set out to help communities transform, and because of your incredible work, we did some of that. But as a foundation, we have been transformed. I have been transformed by your work and your leadership. This transformation and enlightenment is embodied in two quotes from social justice warrior Dr. Martin Luther King, who we just celebrated his holiday celebration yesterday. His first quote is from a speech on justice without violence in 1957, and it's centered on the words, "Our goal is to create a beloved community." The second is my favorite MLK quote on the matter of power. Power at its best is implementing the demands of justice. Our vision of a truly healthy community is now broader, more comprehensive, and yes, more ambitious. But it looks more and more like Dr. King's vision of a beloved community. And BHC taught us that the central path to the beloved community is through community voice and community power. You hear us refer to that term, power, quite a bit in the decade to come. This idea represents the BHC-driven cornerstone of our work in the decade to come, and our board of directors, over the past year, has been engaging in conversations and agreed that this must be the path forward for the foundation. Our transition beyond 2020 is grounded in what we've been hearing from community leaders like yourselves, through feedback surveys, through evaluation reports, and other forms of input, that have demanded that foundations like ours be more responsive to the needs of communities, that we be better partners, that we focus on long-term systemic and structural change, and that we continue to invest in organizing and power building, that we behave better and be a more humble partner. These are the lessons that inform our next steps, and we're excited to get started. Let me talk now about the vision and the three bold ideas that our board of directors have unanimously approved to guide our work in the decade ahead. There are a few pieces of the puzzle still to be sorted out, but I'm proud to share these key elements that the board of directors has committed to, and allow me to speak to the why, the what, and the how of our work in the decade ahead. On the why, BHC has been so successful that it is a fair question to ask, why should we bother changing at all? Why mess with success, you might say? But in short, we're hoping to see the impact of our investments in more regions and more communities across the state. And we want to see our impact at local and regional levels translating into greater statewide impact. The 14 BHC sites have impacted work in the 12 counties they reside in. And simply put, we want to see more impact in more counties across the state of California. On the what? The vision speaks to the future of what Dr. King might have called a beloved California, grounded in wellness, inclusion, and shared prosperity. A California for all. The three bold ideas represent what our board have agreed to, and they come in three forms. And number one is the idea of people power. There's that word power again, where voice, advocacy, civic participation all have a robust role in assuring that the lived experiences of the most marginalized, the most disenfranchised, the left behind, are actually asserting leadership. Number two, that people power translates into reimagining key public systems and policies to assure better health, such as in justice reform, inclusive community development, and schools. And finally, number three, continuing and finishing the battle of health for all across the state of California. Health for all in coverage, health for all in prevention, health for all in equity. And on the how, we are committed to being better listeners, more humble, more values grounded with our partners and with our grantees. This will mean more general operating support grants that are multi-year in length. This means leaving more space to co-design strategies with you on issues or in regional communities. This means more of an emphasis on investing in the infrastructure of community-based, community-grounded change strategies for statewide impact. Leadership support, organizational capacity building, narrative change support, and network and alliance building across and among grantee partners. This means a greater emphasis on racial equity and racial healing in framing our work. Over the years of BHC, this is what we have heard from you across multiple reports and surveys, and we are committed to translating this feedback into practice and action. We pledge to fulfill our mission by explicitly committing to a healing-informed racial equity framework, driving health equity through a racial equity lens. We commit to centering a power-building ecosystem rooted in a healing-informed racial justice lens. And we pledge to reach more Californians through an expanded geographic footprint, growing from the currently we're in 12 counties through our 14 BHC sites. And we're going to attempt to nearly double the number of counties in the years to come. These changes for us are both inspired and hopefully inspiring, but all strategic plans, as you know well, come with trade-off decisions and tough decisions. It will come as no surprise to you to understand that we cannot afford to be in a meaningful, multi-year funding support relationship with every organization who is doing good work in the state of California to advance healthier communities. Currently, our grant resources reach as many as 1,000 nonprofits in a given year. But you can expect us to arrive at a place where we're in a modestly fewer number of grant relationships with a larger proportion of multi-year general operating support grants. We intend to be transparent about how we make these decisions, respectful, and timely on how we communicate both good news and perhaps bad news to grantees we've had over the past few years. Our staff has been working really hard at this, and I'm going to hand off to them to share a few highlights about how they see this and their analysis in the last few months. First up, I'd like to welcome Janine Saunders, who's our director in our learning and evaluation team. Janine?
Thanks, Dr. Russ. And thank you all of us for joining today for an update in our transition planning process. Staff across the endowment have been busy reflecting on the past 10 years and applying those learnings as we prepare for the 2021 transition of building healthy communities. Our vision and 3 bold ideas reflect what we've heard from you, so they should sound familiar. We've taken our bold ideas and internally started to articulate goals that are more focused and goals that are based on the work that we've done in our community. We've worked with our key data partners to conduct an analysis of where power has been built both in our sites and across California, and have been working as a staff to deepen our understanding of the power building ecosystem, both where the ecosystem is strong and where it needs to be reinforced across the state. And as you heard from Dr. Ross, power building will be at the center of our work going forward. We've also worked with partners to build our understanding of where health disparities and racial inequities exist across California, to really narrow in our expansion on those communities with the poorest health outcomes. Through our learning and evaluation activities, including storytelling, we're lifting up key lessons from our work. We've been in conversation with you through dozens of interviews, through focus groups and surveys, and we've collected data from partners across all corners of the state. We're excited to share many of these evaluation products with you in the coming years. In addition, we've been working to strengthen our shared understanding of the root causes of poor health and other life inequities through a racial justice lens, and we've been developing our capacity to apply that analysis. Finally, we're deepening our internal capacity to operationalize our core values through a racial justice framework. From our board to our executives and across our entire staff, we're on a shared journey to becoming a more racially equitable health foundation. I'm excited about what these next 10 years will look like, and excited about the opportunities for us to design them together. I'd now like to introduce my colleagues, Jonathan Tran and Geneva Wiki, Senior Program Managers of the California Endowment.
Thanks so much, Janine. As a Keeping It Real moment, I know that many of you that are on this call today are in the midst of critical work for our communities. In fact, today in the most remote parts of Alaska, enumerators from the Census Bureau are taking the first counts of the 2020 census because of frozen ground makes it easier actually for folks to go from door to door to reach hard to count indigenous populations. On top of that, we're 42 days away from the March primary and 287 days from the presidential election. And so we know that many of you are working incredibly hard to empower residents from the most disenfranchised communities from throughout the state. This is all to say that the team here at TCE understands that we're not the only rodeo in town, and that you all have a ton of work on your plate. So from the comments from Dr. Ross and Janine, we hope you heard from TCE's board and staff that we've been in deep reflection over the work of the last 10 years as we try to plot out the framework for the next 10 years to better support the work in the field. But to be clear, we want to make sure that you know that we're doing more listening and more learning as we gear up for the launch over the next 10 years. This fireside chat alone is just a kickoff of a series of community engagement activities in the first half of 2020. And my colleague Geneva is going to share with you some of the next steps.
Yeah, thank you, Jonathan. So as Dr. Ross said, we want this transition to really honor our relationship with you and your working community. First and foremost, your relationship with your program manager is central. So grantees should expect ongoing conversations with your program managers over the next year about our transition process and particulars about your grant. Second, TC will be hosting a series of community engagement conversations across the state to discuss our framework for power building and systems transformation. Third, as Janine shared, there are a series of local and statewide learning and evaluation efforts underway, which include interviews and focus groups and surveys and regional and statewide meetings. We want to thank everyone who has contributed to and will contribute to our understanding and the shared learning about BHC and the stories of our good work. Dr. Ross shared the why and the what and the how. We want to talk about the when of our transition. So the first half of 2020 will focus on the community engagement activities that I just outlined. To Dr. Ross's point about wanting to be an even better partner with you moving forward, we're also internally reorganizing our staff based on lessons learned about what is great and what is not so great about BHC site program officers and statewide program staff. So we'll be launching a new internal organizational design to better support the next 10-year framework. We anticipate an announcement with more details of our transition sometime in the late summer of this year. And then after the November election, we will host a statewide Building Healthy Communities celebration in late 2020 or early 21. And the official transition of Building Healthy Communities will be in March 2021. So thank you again for joining us this afternoon and for the important work that you do every day. And with that, we'll turn it back to Dr. Ross to take questions.
Thank you, Geneva. And before we open it up officially for questions, I just want to emphasize a point that you heard from Geneva, and this is about our grant relationship with you. I'm sure many of you know, okay, so when am I going to hear something? When are we going to hear something? Some of you have already begun to hear from your program manager. That is going to be a conversation with your program manager. You're not going to get a letter in the mail from me on April 1st or something. It's really going to be about your conversational relationship with your program manager, and you'll hear from that program manager about your future relationship with us and from a grantee and funder perspective. If it's good news, great. Hopefully you'll hear that we want to enter into a multi-year support relationship with you. If it's bad news and we need to inform you about winding down our grant relationship with you, we promise to do that with dignity and transparency, but we also will make sure that you have at least 1 year of running room in terms of grant support to make that transition so you can plan more effectively. So it's possible that we may end up, from a grantee and funder perspective, closing down or winding down our grant relationship with you, but we'll make sure that we do so that you have a heads up and some time to prepare. And then lastly, the good news is that compared to a decade ago, more and more of our fellow foundation leaders and fellow foundation funders are funding more equity work, health equity work, power building work, advocacy work. It's not as lonely a place for foundations to be funding this kind of work, and more of our partners are beginning to do so. And we hope in part inspired by what they've seen you accomplish in BHC. So with that, let me stop there, and Sarah, why don't you tee up some questions for us?
Okay, so the first question actually relates to what Geneva mentioned, and that is community engagement. The question says, how can we make sure we get invited to the community engagement meetings that Geneva had mentioned?
So Geneva, you give everyone your home phone number. Call you 24/7, 365. But how are we doing that, Geneva?
That's a great question. Let's just be really honest.
Yeah.
Okay, we're just gonna be really honest.
Let's not be less than
This is not scripted. So there's one school of thought that we should just invite every grantee we have right now to come to a meeting, and we say, everyone come on and let's engage in the conversation about power building and narrative change and youth power as we move forward. And then there's another school of thought that says we can do that, and we could have a conversation, and that may not be the most strategic use of everyone's time to just say, come one, come all, come to my meeting. And instead it might make more sense to say, let's have strategically invited conversations specific to either the topic or the region or a group of partners in order to really advance our thinking and our analysis together. To be honest, we haven't decided what's the best path forward. And part of today was to say we do want to make sure that everyone has a leveling of information, that everyone's caught up with where we are. And so this was one format. We understand that webinars are not the best format, but it was one format to make sure that everybody had this same access to the same information on the same day.
Okay, next question. Is really around the new expanded footprint. People are wondering when we will be able to share the new footprint for the expanded communities.
Yeah, thank you. So, again, by way of context, the 14 Building Healthy Community sites are in 12 counties, and what we've learned by watching and supporting your work over the years is that the impact of the work in those healthy community sites went beyond the geographic boundaries of the sites themselves. They affected cities, they affected county work, and so we actually want to build on that approach and have the impact of what has been BHC over the last 10 years in more counties across the state, right? So we're going to try and get to, we probably won't be able to more than double the size of those 12 counties, but we're going to get as far as we can to make sure that the effect of the work and the impact of the work of health equity is in more and more counties, because we think that's the path to getting true statewide change. Now, here's the reason why we're doing that, and in this comment I'm about to make, you'll get a sense of how we're thinking about expanding our geographic footprint and our geographic reach. It doesn't work for us, and I'm sure it doesn't work for any of you to know, that a 14-year-old attending a high school in South Los Angeles or in East Oakland has access to better restorative justice and mental health supports in their school setting, but a similar 14-year-old in, let's say, Trinity or Madera County does not, right? And it doesn't work if there are inequitable access to health services for the undocumented in one county to the next, right? So we want to see that as Dr. King would say, health justice anywhere is a threat to injustice everywhere. We want to see more and more counties with consistent access to health equity and health equity supports, right? And so that means moving from the 12 counties that we're in now to more counties and in a regional emphasis. The announcement of this footprint won't be anytime earlier than April of this year, probably be after that. We'll make sure we keep you updated on that. But we are going through a fairly rigorous, fairly defined set of considerations, of qualities, of factors about how to choose a county that we'll be investing in new partners with in the years to come. And hopefully we'll make that decision-making process available and transparent to you after we get support from the board and announce that newer expanded geographic footprint.
Along that same line, a question came in. Are you intending to do community engagement convenings in the current Building Healthy Community sites or in the counties you were looking to expand into, or both? Or, in parentheses, are you figuring this out?
I think the combination of are you figuring it out as well as both, it would be the answer. Because I think we want community engagement sessions based on lessons we've learned on the site-based level, but also the system-wide work that's happening, for example, in the schools and communities work, in the Health for All work. So in each of the systems, we do also want that analysis and feedback from the stakeholder session. So it's still figuring it out in terms of cultivating and curating what the list looks like, but I think there's a commitment to make sure that we have engagement from on both levels.
Mm-hmm. I would also say lots of site program managers are already holding some kind of learning session with their sites, or have one planned in the next few months to kind of get into the weeds a little bit of the kind of analysis that Janine talked about, as well as each site is deep in some kind of storytelling and documentation and reflection process, which is also feeding this back in. The other we didn't mention was we also have a very specific and targeted youth engagement process that runs parallel and coordinated with this. So some of those young leaders who have been engaged with our work for a long time will also have a specific role to play in the engagement.
Another question, and actually a set of questions have recently come in around your conversation around inclusion. There's a lot of conversation and questions around when you're talking about marginalized communities and inclusion of various communities that have been marginalized, how does the trans community fit into that? And is there a plan and discussion and work taking place in the endowment around that? Where does homelessness fit into the BHC problem as we see a large problem in California? Where is the Native communities in this conversation? And then there's some concern and questions around the fear of also siloing communities. And where do girls and women of color work come in? So can you speak to, when you talk about inclusion of all communities, do we mean all? And how do we represent all?
Yeah, thanks, Sarah, for that series of really easy questions. So, for us.
Blame them, not me.
Yeah, for us, and the questions are perfectly fair. For us, full inclusion means full inclusion. Period. New paragraph. Now that also means, however, that we certainly don't have enough resources to meet every population's needs. But part of the expanded footprint is also about the process of us auditing for ourselves where populations like trans, that some of these populations that were mentioned, trans community, the Native American community, fit into our work going forward. I'll just say this, that in terms of the trans community and the Native American communities in particular, you'll see us doing more work, not less work, in those areas in the years ahead, without a specific commitment to any particular dollar figure. But we really do recognize that a racial equity inclusion lens means everybody all in. And we think that the reason why we're so focused on a power building ecosystem is because having an effective power building platform with community organizers and activists and advocates as the cornerstone of the power building ecosystem is the closest thing that we can come to having all boats rise. If there is a strong base building and community organizing investment and emphasis across the state, we know that's going to be better for the LGBT community, better for the folks who do Black organizing and Black community organizing, better for the trans community, better for the Native American community, better for climate change, better for homelessness. So investing in the voice and power building at the local, regional, and state level means that all boats will rise and that all of those issues and populations will benefit in some way. That doesn't mean necessarily that we're going to have a brand new multi-year funded initiative targeting homelessness. We will think more about homelessness in the years to come, but I don't see us switching our strategic emphasis to a specific strategic emphasis just on homelessness as a standalone issue. We will support, through our inclusive community development work, those advocates and those power builders who are involved in those fights in their regions and at the local level. So we'll see benefit on those issues, but that's not necessarily to mean or to translate that we'll have a new major standalone funded initiative for those populations.
Okay. Here's one that runs right up your alley, Janine. One that will get you all excited here. It says, how can we learn about new community prioritization strategy for the next 2020 campaign? And what data impacts that? And how can we contribute to that?
I am excited about the question tonight. All right. So a couple of things. One, we are already in the process of analyzing and learning from data that we've been collecting over the life of building healthy communities. I want to start there so that folks understand that we are not starting a data collection process, that we've been engaged in data collection for many, many years. As we are not only learning lessons from our Building Healthy Communities work, from our local evaluators in each of the 14 sites, from our statewide evaluators, we're also working with data partners who are lifting up data for us that are based on what we've learned in the past 10 years. So for example, we are looking at health disparities data, not just at the county level, but at the sub-county level, looking at racial disparities data at the sub-county level, and really thinking about if we're applying that racial equity lens, and if it's important to us to work in communities that have historically been the most disinvested in, how can we make sure that we're targeting those communities in the next phase of our work? And I would encourage you, I'm not sure what is the best way for us to do this, Sarah, but if you feel like there's a story that you want to share that has not been part of our evaluation work, you haven't been interviewed, or you haven't been part of a focus group, and there's something that you want us to know about your work or your community, would encourage you to reach out to share that information. I'm also not going to give out my home phone number, but I think we can certainly figure out a way for us to learn about those stories, because that's really important to us. Not just important to me as the director of our Learning and Evaluation Department, but important to us as an organization, that the work that we're building on in the next 10 years reflects what we learned in the last 10 years.
The next questions come around, when does this all launch? When is this transition going to transition to something? Is there a predetermined sunset year to this upcoming phase of our work? When does the funding cycle start? So it's really around, when do we launch, and is there a 10-year at the end? Is there so many years at the end?
Yeah. So the board of directors, and let me give this some context in answering that, Sarah. There are a lot of very smart things we did as we launched BHC, and there's some dumb things we did when we launched BHC, and hopefully we learn from those mistakes. The smartest thing we did was to give BHC a decade. It was very important for us to make sure that we gave community organizations, grantees, partners, leaders, the time to grow, the time to develop, the time to connect, the time to build alliances and coalitions. If BHC had been a 3-year program, we would have had very different results than the beautiful 10-year run we've had. So learning from that lesson, we're talking about the next decade of our work, which is roughly from calendar year 2021 through calendar year 2030. Okay. That said, you're not going to see a drop-dead date where everything starts on January 1st, or even on our fiscal year, April 1st. There are a number of moving parts here. And then we also need to make sure that learning from the lessons of BHC, we had, from the site level, we had some sites that were kind of ready to go with their local plans within 3 or 4 months. We had others who took a bit more time and needed the better part of a year. So not every region and not every county and not every place or community moves at the same pace. So we're going to be thoughtful about giving folks the time and energy they need and the space they need to build their own local and regional strategies, to build their own local and regional alliances, to move this work into more counties across the state. So we're going to be patient about that, and we're going to be hopefully a better listener and a better partner. But by and large, this gets going officially in calendar year 2021, if you want to put an official time frame on it. But the work of change is already beginning now. We are right now beginning to research, for example, how is it that we can move to more multi-year operating support. We've actually increased the number of general operating support grants over the last 2 years. That's something we've learned from BHC, from listening to you. And so we're going to continue to ramp that up, hopefully with more assertiveness and a bit more boldness. But the bottom line is your relationship with TCE is really your relationship with a program manager. That's the core of your relationship, and that relationship will live in the space between you and your program manager, and the real changes you'll see will be in that relationship and during that period, throughout that period of time in that time and space. But you won't see us pulling the curtain back on January 1st, 2021, and everything will be completely different. It'll be more a gradual, thoughtful, smart, deliberative transition from the last 10 years of work to the next 10 years.
I promise that I did not write this question. It did not come from me. It didn't come from Francisco sitting next to me or Geneva, but I'm going to ask it anyway. It says, rural communities, grants, investments only make up 1% of all philanthropy investing in partnerships. How will TCE collaborate to bring awareness to the rural forgotten communities of California?
Great question. That
I
actually,
didn't answer
I
that
know.
question, Dr. Ross.
That's Sarah saying that because she's been beating me up about the Central Valley for years, and Geneva's been beating me up about the rural communities and native communities. But this is part of the reason for going from 14 sites in 12 counties to an expanded geographic footprint. We have to do more and better by rural communities, even some of the frontier rural communities. We plan to do that. We're going to have a specific plan identified yet, but that's part of the county expansion, the geographic expansion, is to get into some more rural counties, and also some of those rural counties, of course, house many of our tribal and native communities as well. So you will see us do more and better in those populations. I can't promise you that you'll be thrilled with what the outcome will look like, but we will do better and more in those rural and frontier communities.
And I think part of the shift into the power building work is just a recognition that within the power ecosystem,
A lot of work to be done.
a lot of work to be done in
Yes.
the
In
areas,
those communities.
especially in the rural communities where the infrastructure is still developing. I think
Yes.
those are one of the things that we're looking as part of the community engagement sessions is to figure out where are the gaps, where do we need to be in terms of
Yeah, so
supporting.
you'll see, thank you, John. You'll see us do more in rural, more in Central Valley, not less, more in the Inland Empire, not less. So those are that's part of the geographic expansion, and the geographic footprint expansion is doing more in those kinds of communities.
Another question that came through was many large foundations, including the California Endowment, no longer accept unsolicited proposals. How can inclusion flourish with this approach? Marginalized groups don't often have major advocacy groups working with them.
Yeah, it's a great question. It's a fair question, and we've in our history at TCE we've done both. We had a reservoir or a portal is a better term to receive unsolicited proposals, and through much of BHC we stopped doing that. We're still figuring that one out, Sarah. I would say that by and large, what you have to weigh against is those of you know as grantees, it's a lot of work to put a proposal together. And you know, it's wonderful to get a clean answer and a quick no, but you do have to take into account the amount of work, sometimes weeks and weeks, people have putting a proposal in that's unsolicited. So the upside of having a proposal framework where we only accept solicited proposals is that there's a higher likelihood and a higher assurance of getting that proposal supported and funded, and hopefully less wasted time and energy, human capital wasted time and energy on the grantee side in doing that. So that question is still on the table for us. Don't have a clean answer for it yet. But what we want to do is, again, how are we a better, humbler partner with grantees? How do we provide time and space in the relationship between grantee, that is you, and us as funder, so it feels more like a partnership, feels more like a two-way conversation, and not an ATM relationship where you're shoving a proposal in a slot and waving, lighting candles and praying that dollars come out. So, but well, the answer to that question is how can we be and show up as a better partner with you? And either way has its upsides and its downsides, but we haven't answered that one yet.
Great. Another data question. In regards to looking at data, can we ensure that we're looking at disaggregated data, especially in the Asian American and Pacific Islander communities, to ensure that we see the real health disparities that exist?
Absolutely. We are looking at not only disaggregated data, but we're looking at data down to the census tract level, because I think one of the things that is really important to call out in this question is that if you're just looking at a county as a whole, or if you're just looking at Asian Pacific Islander data as a whole, that it does obscure some of the pockets of disparity that we know exist in even a county where folks are doing well, and in a population where it might seem like folks are doing well. So yes, we are looking at disaggregated data where we can get it. It can sometimes be challenging for populations that are small, which is part of the reason why we're working with data partners, and also why we need to be in conversation with folks in our communities, because I think that the data that we have, the numbers that we have, and the stories that we have, and the interviews that we have can really still only tell us so much. And we need to be in conversation with folks about what's going on in their community so they can let us know what our analysis has missed. And I think that this is an opportunity really, I think, for folks to share across a variety of these questions that we've been talking about today. What are your thoughts on strategies for creating a more inclusive grant making? What are your ideas for serving Native communities? What do you want us to know about disaggregated Asian Pacific Islander data? I feel like in our community engagement process, there will be opportunities for you to share back with us so that we can get a better understanding of what those questions and concerns are, not just the ones that come up today, but the ones that you're also holding.
Another question is, will the focus on leadership support also include a focus on developing or supporting organizational/policy leaders of color and Women X leaders?
Yeah, great question. We're going to be spending a good portion of this 2020 calendar year probing on how we show up in the space of leadership development. And if this goes well, we'll have a leadership development investment strategy that is actually co-designed by leaders doing work, organizing work, activism work, advocacy work. So we haven't completely landed on that yet. We know for sure that we'll have a space for young people and their leadership development in any leadership support investment strategy. We certainly will have a place for intergenerational support. We certainly will have, and someone mentioned earlier, not only boys and men of color, but girls and young women of color as well. We'll have leadership support for those populations going forward. Also, we don't know exactly what it's going to look like yet. Part of what we'll be doing this year, many of you know, this falls in the category of a build versus buy decision. There are leadership support programs out there. What's their capacity? Is it enough? Does it really meet the needs of social justice warriors and health equity warriors around the state? Do we have to create some new infrastructure, or should we be investing in existing infrastructure, perhaps knitting that together better for folks doing work across these various regions? And so we'll be spending the year in 2020 looking at answering those questions about how we show up best and smartest and thoughtfully in a leadership development and leadership support space. And I would add to that, we're thinking about narrative change capacity as well. We've been hearing from grantees over the years that we do need more leadership support, we do need more narrative change capacity support, and we'll be spending 2020 looking at what does that mean structurally in terms of our investment. Is it regional? Is it a statewide thing? How do we do that? So stay tuned, but it's something that I am really enthusiastic and excited about, because all of you know, at the end of the day, this is all about leadership.
Another question,
which I think you would all want to answer is,
what are some of the, and I'm quoting, gnarly decisions you are facing during this transition, i.e. it's a dilemma because there's no real clear right or wrong answer or even route to take?
Great question. It's the keep me awake at night question.
Yep.
The trade-offs of, if you can imagine, so here's the key trade-off. We're going from some statewide work, of course, but also the core of building healthy communities was the site work in the 14 sites in those 12 counties, right? And so now we're trying to find and plot a way to get from work in those 12 counties through those 14 sites to perhaps nearly doubling the number of counties that we're in, and do that building off of the platform and the strengths of BHC, which have been significant, and do that with basically a little bit more money, but basically the same amount of resources, right? So you can imagine the tough trade-off decisions there. I think the toughest trade-off decision is if we want to commit to what grantees have been asking us to do over the years, which is, stop nickel and diming us with one-year grants, stop micromanaging us with all these project grants, provide us with more multi-year operating support and general operating support grants. If that in fact is true, and it will be true, and we will do that, you can't, with the same amount of resources, expand or even maintain the same number of grantees you've been supporting. So in any given year, we support as many as 1,000 grantees in a year. Some number between, on the low side, maybe 600 or 700. On the high side, 1,000, as many as 1,000 grants a year. Some of those are through sponsorships and one-year special opportunity grants. They're not all year, multi-year support grants. But we want to move from that level of grant activity to a level of grant activity which is in the aggregate a smaller total number of grantees compared to the 1,000 we have now, but getting into a multi-year support relationship with many more of them, or a larger proportion of them. So that's the trade-off, is how do you do that? And also, how do you do that by trying to get into some newer communities where we haven't been before? And so if there's something that's keeping me awake at night, and hopefully some of my staff awake too, is thinking about how to do that, and how to do that smartly, carefully, and thoughtfully. Again, and I'll just reiterate something I said earlier, Sarah, the good news is that more and more of our foundation partners and the foundation community are investing in issues of social justice, of racial justice, of health equity. For example, our great colleagues, someone mentioned homelessness earlier, our colleagues at the Kaiser Permanente and their foundation work, they're committing more to homelessness, which is a very serious equity issue. Right, the Weingart Foundation is committing to a racial equity approach. We heard a great announcement last week or a week or two ago from our colleagues at the Libra Foundation, investing in power building. So it's not as lonely a place, and hopefully more of philanthropy will get on board this train of a power building ecosystem and power building for a California for all. And so if I get sleep at night, it's knowing that those resources are heading into the till at a higher and greater rate from our colleagues in philanthropy. And so I'm pleased about that development. And hopefully folks who are left out and left behind from our grant-making process will be supported by some of these other funders.
Great. And along that same line, Dr. Ross, the question came in is, how is TCE looking to engage other funders in our work for the next decade?
That's ongoing right now. It's been ongoing over the past year or more. We probably will not end up with one giant mega funding pool that we all agree to put money in as foundations. Foundations are, just like nonprofits, have their own unique boards and are unique animals and creatures of habit. But that's one thing that will be different in the 10 years ahead. we will be entering into the next 10 years of work with more pledged and committed partnerships than we did at the beginning of BHC. I think that was a fair criticism from many of you and from our grantees that we needed to have more partners in BHC. And so this next 10 years of work, which is about a California for all, right? We have a governor who is now talking about a California for all. So a California for all is now within our grasp, but it's only going to be within our grasp if our political and civic leaders and philanthropy and those of you doing the work, if we're all on the same page moving forward, and we think it will take a decade of work to do that.
Okay, a last couple of questions here. Is there any plan for a revised program-related investment or mission-related investment strategy that will work in tandem with the revised strategy?
Oh, that question's so perfect. Thank you, whoever sent that one in.
Not a plan.
Yeah, so, good, the good news on that front, again, learning from you, what we've heard from you over the years, is that our board in recent, over the last two board meetings has approved greater funding both for PRIs, program-related investments, and for mission-related investments. So we'll be doing more PRIs and more MRIs, and we're looking at ways now to, we just expanded our PRI team and our mission-related investment team, headed by Amy Chung, and we are indeed looking at how to marry and integrate the MRI and PRI work with the bold ideas that are in the Beyond 2020 plan. An example of that is inclusive community development. Expect us to put more resources through either MRIs and or PRIs that support positive, inclusive community development in these many of these regions and many of these communities.
A lot of questions around statewide grantees and what is their role in this new expanded footprint, and how does that work with the local work, and how do you see that partnering together?
Yeah, we've heard, again, another area where we've heard a lot from you as well as our staff, that our statewide work and our regional and local work has not been as integrated as it needs to be. Two things on that front. This power building ecosystem that you've been hearing us refer to, we see as folks doing statewide work and local work and regional work, right? So we are not pulling the plug on our statewide advocacy investments. In fact, what we're doing is part of the internal restructuring and redesign that Geneva spoke to, is actually how do we optimize our organizational ability to respond to better integrated and regional and statewide work. So we're actually changing our organization and how we're structured to more of a matrix organization that involves statewide input as well as local and regional input. Not easy to do, but we're committed to doing it. And if you see any of our staff at TC in the next months complaining about migraine headaches, that's the reason why. We're trying to figure out how to structure that approach in a way that meets that statewide, local, and regional interface. That's how you get to a California for all.
Okay. Final question, your closing remarks, Dr. Ross, and that is, does TCE want to see more of what has been achieved over the past 10 years or something different? I'll turn it over to you.
Oh, that's the easiest question. Yeah, more. The board and I, as I said, we're thrilled with what has happened with BHC. We've seen, as Tony Eichen and his team have, along with Han, our Chief Learning Officer, documenting as many as 1,000 local wins in the 14 BHC sites. And we've seen substantial and significant statewide impact. I mean, remember, it was through our partnership with you that we began talking about a new narrative, a for all narrative for California, health for all, right? Came from the mouths of the dreamers in the DACA battle and the Obamacare battle when immigrants, undocumented immigrants, were left out. And now we have a governor who is talking about a California for all narrative, and I'll be starting on Monday serving on a statewide commission that the governor is called the California Health for All Commission, right? So the for all narrative is been inspired by your work in VHC. The combination of both statewide impact and local impact are rolling up into a broader statewide narrative. And that's the reason for doing this. We want to see more impact, not only in more places, but greater impact statewide. And I just want to thank you for all that you've taught us over the last 10 years. And if there's one more thank you I've got to do, it's your patience. We've been in strategic planning for quite some time. I know your response was be enough already. We're feeling it too, but we're getting very close to implementation, and you'll see implementation beginning to start in this calendar year.
Okay, thank you. We've reached the hour of 3 o'clock. There is a lot more questions that we couldn't get to.
Can I
but,
get to them by
we
electronically?
will make sure that we get them and send them out to all those who have joined us today. And so I have them all here and we'll get through those. Just to inform everybody, this webinar has been recorded and will be made available to everybody on the webinar as well as anybody who wasn't able to attend, and you're welcome to share it out to others as well. And there will be more information forthcoming in the future. So thank you so much for joining us.
Thank you, everybody.
Thank you.